Hello everyone. Today, we're diving into the world of a medication called Umeclidinium, commonly known by its brand name, Incruse Ellipta. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Umeclidinium, known by its brand name Incruse Ellipta, is an inhalation powder that belongs to the category of long-acting muscarinic antagonists, LAMAs. Its primary function is to help manage chronic obstructive pulmonary disease, COPD, which includes conditions such as chronic bronchitis and emphysema. Umeclidinium works by relaxing the muscles around the airways in the lungs, making it easier to breathe. It helps reduce the symptoms of COPD, such as shortness of breath, wheezing, and coughing, and improves overall lung function. Incruse Ellipta is typically used once daily and is not intended for the treatment of acute bronchospasm or asthma. Warnings: Incruse Ellipta comes with its set of precautions. It is not intended for the relief of acute bronchospasm or as a rescue inhaler. Patients with severe hypersensitivity to milk proteins or any components of Umeclidinium should avoid using this medication. Additionally, it should be used with caution in individuals with narrow-angle glaucoma or urinary retention, as it may worsen these conditions. Before taking this medicine. Before starting Umeclidinium, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug or any of its ingredients. Discuss any history of eye problems, such as glaucoma, or any bladder issues, as these conditions may affect the use of Umeclidinium. If you are pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider to understand the potential risks and benefits. You should not take Umeclidinium if you are allergic to it or any of its ingredients. It's also important to let your healthcare provider know if you have any other medical conditions, including heart problems, high blood pressure, seizures, thyroid problems, diabetes, or liver disease. If you are taking other medications, including prescription and over-the-counter drugs, vitamins, and herbal supplements, inform your doctor to avoid potential interactions. Side effects: all medications can have side effects, and Umeclidinium is no exception. Some individuals might experience common side effects such as upper respiratory tract infections, stuffy or runny nose, cough, sore throat, and joint pain. There's also a potential for more serious side effects, such as new or worsened eye problems, including blurred vision, eye pain, or seeing halos around lights, which could be signs of narrow-angle glaucoma. Urinary retention is another serious side effect, and symptoms may include difficulty urinating, painful urination, or a weak urine stream. Additionally, there is a risk of allergic reactions, including rash, hives, and swelling of the face, mouth, or throat, which require immediate medical attention. Other potential side effects include cardiovascular effects such as irregular heartbeats or palpitations. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Interactions: Umeclidinium might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Specific interactions may occur with other anticholinergic drugs or medications that affect the heart. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Umeclidinium. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The recommended dose of Umeclidinium for most adults with COPD is 1 inhalation once daily, using the Incruse Ellipta inhaler. It's important to use the inhaler correctly and consistently at the same time each day. Never alter your dosage without consulting your healthcare provider. Avoid: while on Umeclidinium, it's advisable to avoid activities that can exacerbate your COPD symptoms. Ensure you know how to use your inhaler correctly, and avoid exposure to irritants such as smoke, dust, and strong fumes. Avoid contact with the eyes, as the powder can cause eye irritation or worsen glaucoma. As with many medications, it's recommended to avoid excessive alcohol consumption, as it can affect overall health and exacerbate certain side effects. FAQ: many wonder about the age restrictions for Umeclidinium. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing: that wraps up our overview of Umeclidinium. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.